Stay connected. Make sure you hit the subscribe button. Greetings, Tim Bennett here from the Cortland Voice. I'm here with Dr. Anna Marie Garcia. She's from Cayuga Health. Good morning, Dr. Garcia.
Good morning.
How are you today?
I'm doing well. How about yourself?
Good. So tell us about yourself and where you're from.
All right. Well, I grew up in upstate New York as a child, and I went to college in Buffalo, and I studied biology, and then I went on to my PhD in molecular biology in Buffalo as well. And from there, I traveled to Nashville, where I spent 7 years. And during that time, I did a postdoc. And then from there, I went on to Vanderbilt University to do my degree in medicine. And afterwards, I moved to Maryland. So I lived in this nice town called Ellicott City, Maryland. It was about a half hour out of Baltimore, where I did my residency for OBGYN. And while I was in Maryland, my belated husband was being recruited by Cornell University to be a professor in engineering. And at that time, we felt it would be nice to come back to a community where I had grown up in, was familiar with, and be able to offer my services in the local area. And then we moved to Cortland, and I was in Cortland until about 3 years ago, until I recently moved to Lansing, which is a very beautiful area. And I actually enjoy both communities very much.
I see. And you've been in the field over 20 years, correct?
Yes.
Beautiful. So your first practice in the area opened in, I believe, 2005?
Yes. So I came to the area in 2002, and it was September of 2002, and I opened up my own practice independently in 2005, and I was had the practice for 15 years. And after 15 years, because I wanted to continue with growth and put more focus 100% on patients and patient care, instead of having to split my time between running a business and patient care, I found it to be a win-win situation to merge with Cayuga Medical Associates.
That's great. Now, let me ask you this. I want you to explain to our community the importance of GYN care for a woman.
Okay. GYN care encompasses a broad range of issues. Many times in the community, people assume that a GYN is only there to do an annual exam, to do a breast check, to do a pap smear. That only scratches the surface of what a GYN actually does. For example, in my practice, aside from just doing the routine, I deal with a lot of complex issues with women, especially things such as pelvic pain, endometriosis, vulvar issues, fibroids. Another thing that I have a lot of focus on is looking at familial history for certain types of cancers, because there are some things that do run in families. And so every patient that comes through our door is screened to see if they have family history and whether they meet criteria for doing genetic testing. And we do find quite a few patients that do have predispositions that increase the risk for things like breast, uterine, colon, ovarian, etc. And there are things that can be done to minimize those risks, or sometimes even eliminate those risks before they actually develop these malignancies. So that's another focus that we have, or I have, as a GYN. The other thing that I deal with as a GYN is incontinence, which many women suffer silently with. And oftentimes there can be up to a 90% cure for many types of incontinence that are the more common ones. And people are not really aware of that, or they don't bring that up. So in terms of what can a GYN do, it's a huge breadth of specialization, and depending on whether a GYN wants to focus more on the primary care aspect, of doing like more the routine, or they want to become very, very specialized. All of this falls under that umbrella in terms of what we can offer.
Now, let me ask you this. What drew you to wanting to offer minimally invasive gynecological surgery to your patients? That was a tongue twister. I had to make sure I said it right. Also known as MIGS.
So I've always enjoyed doing surgery. I like the problem solving of trying to figure out what is going on with my patient, and what can be done to help her in terms of her recovery, in a way that she can get back to normal life as quickly as possible. And for many years, before having robotics in the area, I did all of my, the majority of my surgery was done laparoscopically, which can be quite a steep learning curve, because it's not a very ergonomic type of surgery for the surgeon. However, the patient would have such a wonderful outcome, and in terms of being able to get home and get back to normal activities. With the ability to do robotics in the area, I am able to do the same types of surgeries, except now I have a tool that gives me much more precision, much better visibility, much better ergonomics to be able to deal with things such as like deeply infiltrating endometriosis, for example, large fibroids, where in the past women would have to most often have a laparotomy or an open incision and be in the hospital for several days. The majority of my patients, even if they have a very large fibroid uterus, will be going home that day. And most of these patients are back to work within a couple of weeks with very tiny incisions. So there's definitely advantage, because people are busy, people want to get back to their lives. Sometimes people delay having surgery because of that fear of having to be out of commission for 4 weeks, 6 weeks, when that doesn't have to happen. And by being minimally invasive, you do allow a much quicker recovery, an easier recovery, and ability to return back to normal function sooner.
It's amazing what over the years, I'm sure the advancements in medicine and health since you came in 2005 to now,
Yes.
how long would you say, the MIGS, that procedure, how long would you say that has been going?
Well, MIGS is it's a brand new certification that just came out this year. However, it has been ongoing, so it's finally been recognized as an area of specialization for a distinct group of GYNs that focus on that. So, for example, anybody that's doing laparoscopy or vaginal surgery, or these types of things are considered minimally invasive surgeries. Is in order to qualify for MIGS, you have to be a high volume surgeon, which means you have to have a large number of being able to do hysteroscopy, for example, where you're looking in the uterus with a tiny scope. And this is something actually I do in my office, so people do not have to go to the hospital for this. About 95% of my patients I do in the office. I'm the only one in the community that does these in my office. The MIGS also encompasses dealing with the more difficult types of minimally invasive surgeries as well. So it's beyond just doing laparoscopic or robotic hysterectomy. It's also being able to dissect into the spaces, where the ureters lie and the vasculature lies, if there's deep infiltrating endometriosis or there's a lot of scar tissue. So it takes a long time to develop those skills, and in order to stay proficient, you have to, you know, be doing this on a very regular basis. You know, I operate 2.5 to 3 days out of the week between whether it's robotics, laparoscopy, you know, vaginal surgeries and hysteroscopies. So, you know, I do keep up my skills, you know, with that. It's important also that when you are developing as a surgeon, to make sure that your skills are going to be on par with people that are at the top of their field nationally. Those are the people you want to compare to and try to aspire to be able to do the things that they are also doing. And that allows you to bring, you know, those advanced skills back into your own community to benefit your patients as well. And, you know, be willing to put in that extra effort to learn those skills and be able to do that. But you, in order to develop those skills, you really have to just be focused on GYN. It's very, very difficult or nearly impossible to do it if you're also doing obstetrics, because obstetrics is such a pull away from the ability to put your focus on GYN. And I know this because I used to do obstetrics until about a decade ago when I switched over to completely GYN.
I see. Yeah. So you're specialized. You're getting the, I don't know, do they use this term for health? Continuing education unit. Mm-hmm. Yeah. So I mean, bringing all of that here and just hearing that it's a brand new thing that just came out within a year or 2 years ago mm-hmm. in this area, and you brought it here. That is amazing, and you're taking care of the community with that. So.
Right. And there are about 500 people now that are certified in the country. And I was in the first cohort to sit for this exam. So with a lot of hard work and luck, I managed to be amongst the first about 500 people to pass this test.
Oh, wow. Well, congratulations on that. Let me ask you this. Are there any other ways that your practice or the services that you offer differ from, you know, any other provider, wherever that may be? I mean, I know you are one of 500, you know, one of 500 that have it, and that's out of possibly thousands, maybe tens of thousands. I'm not sure how many there are, but I do know that, you know, I do know it's rare, you know, once again, 1 in 500. Are there any other things that separate you from the others?
I would say the fact that I'm a high volume surgeon, my focus is strictly GYN, where I am taking the difficult cases. I'm taking the cases that the other people are have been referring out just because of the complexities of some of these cases. And rather than having to send them, you know, to, you know, Syracuse or Rochester, you know, I can do these same procedures here, which is very beneficial for patients. There are, I'm sure there are going to be more people with MIGS, you know, down the road as you know, taking the exams. They do have fellowships, you know, for people to do MIGS, you know, at universities throughout the country, at medical universities throughout the country. But there's not a huge number. There are things that I feel very comfortable with because I do them every week, and I'm very, you know, it becomes much less intimidating to do a complex surgery if you've done a lot of cases, because this, you know, you're going to be a lot more comfortable dealing with the more difficult anatomy versus like if you're only in the OR, you know, a couple of times a month, it's going to be hard to have those skills. As with anything, it just takes a lot of just repetitive
time and work. And you've put that time in, and you see a lot of clients, and you're putting in the education to be one of 500 out of everybody. So I think everything you said it for itself. Are there any closing comments that you'd like to make to reach, you know, our Cortland community, or I should say greater Cortland community, because we do reach the surrounding areas as well?
Yes, oftentimes there are things that are missed or not seen because patients don't think to bring them up, and people are very busy, with their different practices. That it's not their main focus, and these are familial history of certain types of cancers, such as like breast, ovarian, colon, uterine. Because that can have a genetic predisposition. The other thing is oftentimes women will go through multiple physicians because of issues with pelvic pain. And the sad thing is oftentimes these patients that are bounced around will think that it's inside their head. Well, it's not inside their head. There's something going on in their pelvis. We just have to figure out what it is, or what needs to be addressed. So there, don't, if there is an issue, don't assume that it's not there. Because things like endometriosis, for example, it's a chronic condition, and the sooner it's addressed, the better the quality of somebody's life. Incontinence is another thing that people suffer in silence. Oftentimes they're very embarrassed to bring it up. And when they're going for their visits, they aren't necessarily asked about that, because if somebody's not really specialized in dealing with incontinence, it's not going to be the top thing on their priority. They're going to have a lot of other things that they're going to be prioritizing instead. But if there is an issue with incontinence, oftentimes there are things that can be done very conservatively that can improve that, all the way to surgically. And even with that, that's a straightforward same-day procedure where people go back to work, within the next day or a couple of days. So, it's important to continue to go for your care on a yearly basis, because there are many things that, even if you have had a hysterectomy, or even if you're like, I'm over 65 or I'm done with having children, these are not reasons to stop going to your gynecologist, because there are things that can get picked up on, that can be subtle and very preventative in terms of leading to bigger problems down the road.
Beautiful. Well, I do thank you for meeting with me today, Dr. Garcia, and I'm sure the community is appreciative as well. And to everyone watching, thank you for choosing the Cortland Voice. Stay connected. Make sure you hit the subscribe button